And just this morning, the World Health Organization is warning that the current situation in Gaza has reached an unprecedented emergency level. It says hospitals are overloaded with patients. And the UN reports over 77,000 people have been injured as of April the 29th. Now, meantime, Israel's evacuation order has forced one of the main hospitals in Rafah to shut down. Joining us now is Dr. Moira Leng, Medical Director for the Cardis International Palliative Care Trust. Doctor, I can't thank you enough for your time. Really appreciate it. And I just know that you just recently visited Rafah over Easter. What did you find?
Thank you. I think that WHO report put its finger on it. The hospitals were overcrowded. Patients were, a 60-bedded hospital had 700 patients. The accident emergency was busy. I was particularly looking at those with chronic illness. Can you imagine if you haven't had your medication for your cancer, your heart disease, your kidney disease, your diabetes, and then you get an infection, you're malnourished, you've got no access to hygiene, and then on top of that, you might be injured in a bombing. And also in none of those situations is there access to pain relief, and that's a particular interest of mine. So the situation at Al-Najjar Hospital was really very serious. But I also want to say that the healthcare staff were working above and beyond. They're some of the most courageous and compassionate human beings I've ever met. And the way they were going to try and do everything they could to care for patients was quite amazing and very, very humbling to see.
Doctor, I just want to underline what you said at the beginning of your conversation. You were at a hospital with a 60-bed facility, and there was 700 people inside that? I mean...
There was people in beds. There were people who were outside the hospital, but inpatients were coming in and out with their drips. There were people coming to the emergency room, including trauma, although it's not a trauma hospital. There were pediatric patients that were moved to an adjoining facility. There were tents outside to try and triage patients. And the cancer care was even in a separate clinic 2 streets away. And all of that has now been forcibly evacuated.
Yeah, I mean, let's talk about that, because Al-Najjar Hospital was just evacuated. What does that mean for patients, and just how many people are being affected?
It's a huge number. Even the building where I was living when I was there is now evacuated. They've gone to 2 other, one small hospital, one other field hospital. But I can't imagine, these people have been displaced 4, 5 times. Even the medical staff are living in tents. It's 40 degrees heat. Just surviving in Rafah when I was there was hard enough. Most healthcare staff had lost 30, 40 pounds in weight. And that's in a place where there's some access to food. In the north of Gaza, where I have colleagues, it's far worse. Then to try and displace again, the cry came up from everyone, where can we go? And there just is nowhere to go.
Where can we go? And I'm just thinking, Doctor, the Israelis say that many Hamas leadership officials are essentially living in tunnels under Rafah. So those people don't have to face the reality that you saw above ground. I'm just wondering, that kind of dichotomy, how concerning is that?
I think the reality is that 6 months into this conflict, there is no one who is not suffering. And I don't want to downplay anyone's suffering anywhere. I'm a doctor. We don't want to see any deaths. We don't want to see anyone injured. But Gaza at the moment is, the situation there is absolutely horrific. It's against humanity. I felt ashamed. I felt ashamed. I was inspired and in solidarity with my healthcare colleagues who are under attack throughout Gaza and now also in Rafah. But I also felt ashamed that the international community has not brought an end to this. One of my colleagues said, please tell the world outside, we want to live with peace and dignity like anyone. We are human beings. And that's what I think we should see. These are human beings, and we need to treat them just as if they were our neighbors here.
Dr. Moira Leng, I thank you very much for being with us. I very much appreciate your time.
Thank you.